morning, Mr. Anderson. My name is Patrick Gibbons. I'm from Hospice of the Western Reserve.
Hi, Patrick. Please call me Mike.
Okay, thanks. I just wanted to stop by to see how you're doing. I understand you've been through a lot lately, and I wanted to see if you wanted to talk about things.
I'm okay. Everything's okay.
Well, if there's nothing you'd like to talk about, would it be okay if I ask you a few questions?
Sure.
I understand you completed a DNR, and we have that on file for you. But have you thought of expressing your other wishes, for example, completing a living will?
The lady who was here the other day, she mentioned it to me, but I told her I would have to think about it, and she left some paperwork somewhere.
Have you talked to your family about this?
No, I don't really have any family. I haven't talked to them for years. They don't know that I'm sick, and frankly, I don't know that they would care if they did.
Do you have any friends or other support right now?
I do have a friend, but I haven't talked to him in a while.
That sounds really lonely for you.
Well, one of my old friends does come around occasionally, but I haven't talked to him in a while.
Maybe you could give this friend a call and tell him you're home from the hospital.
Not yet, but maybe I will.
Would this friend be someone you could trust to help you with your living will, or even be your durable power of attorney for health care?
What's that?
That's someone that would make decisions for you if you're unable to do so. You would need to have a conversation with him and tell him your wishes, and he would make sure that they're followed.
That sounds like a good idea. Maybe I should call him.
While we're talking about these things, how about rehospitalization? Would you want to go back to the hospital for any reason?
The doctor told me there was nothing more they could do, so no. But I am concerned about what happens when I can't live alone anymore and I need help taking care of myself. To be honest, I hope it's quick and I just don't wake up one day.
Mike, I can understand how you feel that way. You're young and had your whole life ahead of you. Is there anything else you'd like to talk about? For example, do you have any spiritual concerns?
No, I mean, I believe in God and all that, but no, I don't have anything right now I want to talk about.
Although the patient states he has no spiritual concerns, it's clear that he does. Evidence of these concerns exists throughout my conversation with him. For example, he doesn't seem to mind that he has no contact with his family, but he does seem troubled that for the most part he feels abandoned from his friends. He has also expressed concern about how he will take care of himself, and he hopes he dies in his sleep. All of these examples show evidence of spiritual and existential concerns. You will notice we haven't discussed religion at all. It is important to listen throughout the conversation because sometimes the patient will demonstrate spiritual or existential distress and not be aware of it. Like sometimes just expressing our wishes to someone relieves our anxiety and the anxiety of those who care for us. Maybe you should have a conversation with your friend, and if you need help with that conversation, we can help with that. I'd like to come back in a few days to see how things are going. Would that be okay?
Sure, Patrick. Thank you.
These conversations can continue throughout the course of care, for spiritual or existential concerns may change as the patient declines. The goal is not to fix the problem, but to provide a supportive environment for the patient. Remember, spirituality addresses the patient's connections and meaning.